Hello, and welcome to another episode of Health and Wellness. I'm your host, Karima Williams, and today I'm here with Dr. Janice Burke. She's the Dean of the School of Health Professions here at Thomas Jefferson. Thank you so much for having us. First things first, when you hear occupational therapy, the first thing you think about is, oh, workers' comp. If I slip or I fall, I can always have an occupational therapist, but what exactly is occupational therapy?
Yeah, well, I think you've asked, the million-dollar question, and a hard question to answer.
Yeah.
It's something that occupational therapists live with their whole careers, and many people think we should change our name. But at any rate, we came from the early 1900s. We were first established, and the word occupation or occupatio really meant how you occupy your time.
Right.
And it was felt that with the first patients we saw, who were people who were in insane asylums, that the problem was that they didn't know how to occupy their time. They didn't have any good habits. They just kind of walked around in a stupor, if you will.
Wow.
And so people came in and started saying, well, what if I start to teach you the routines of a day?
Wow.
And what if I start teaching you things that you can do that you enjoy?
Yeah.
And what if I start teaching you how to prepare meals and how to take care of yourself? And so it kind of grew out of that era of how people occupy their time in meaningful activities. Activities that you really need, so that you can get dressed, get to your job on time, and have what you need with you.
Right.
But also so that you can not drift into delirium or delusions, but that you can feel good about yourself, whether it's knitting, crocheting, running, swimming, hiking, whatever people like to do. So nowadays, in modern times, you would say that occupational therapists help people who have had a disabling injury.
Yeah.
Like
get back
veterans.
to doing the things that they love.
You've got it.
Yeah.
Or help kids in school who don't have the habits that they need to be able to get their books out of their book bag, into their desk, out of their desk, ready for the class.
Right.
So it's teaching people how to do everyday things.
So you work with a range of different ages.
Yeah.
Wow.
Yeah.
So please tell us more about your program here. What typical education do the students have with occupational therapy program?
Okay. Occupational therapy students come to the program either when they are in the last year of their bachelor's degree or after they've finished it.
Okay.
In order to get into occupational therapy, you have to be master prepared. So you must have a master's degree. So as I said, you can come with a bachelor's and finish your bachelor's and go on to get a master's, or else you can come after you've received a bachelor's somewhere else and get your master's degree. And we also have something called a post-professional doctoral degree, which is for therapists who have been out practicing and have a master's degree and would like to...
it's like a certificate program, though?
We have some certificates. Where advanced practice certificates where you just are looking at a specialty area, but we also have an entire program for clinical doctorates.
Oh, wow. Okay. Well, the school I know is internationally known and recognized. So could you tell us more as to why you believe that in your own opinion, that the programs are well respected here at Jefferson?
Well, I think it's a few factors. Always, right? It's never one thing.
No, it's never one thing.
It's never one thing. So I would say that the faculty is outstanding.
Wow.
The faculty is involved in research, scholarship, teaching, and service.
Right.
And the faculty is very diverse in their thinking.
Right.
So we have some people who are specialists in spinal cord injury, some who are specialists in Alzheimer's disease, some who are interested in intellectual disabilities, some who are interested in autism, and the list goes on
and on. Oh,
so then when you have a group of faculty who are all doing research and teaching and scholarship, meaning writing, publishing, lecturing, and community service, that provides just a lot of output.
Right.
So people get to know us because our faculty are writing They're presenting at conferences.
Wow.
They're making contacts with other people who are doing similar things. So we've really enjoyed a long, productive time getting people to know us.
That's good.
Yeah.
Yeah.
It's very exciting place to be. I would say also our students are phenomenal.
Yeah.
They come from all over the region. They have great backgrounds. Some of them were public relations and marketing people. Some of them were business people. Some of them were philosophy majors or religion majors. So we have a wide swath of...
Now, do you have like any like personal story that maybe you know of a student who transformed? Because that's a huge like career change. I used to be a teacher, or I used to be a businessman, and now I want to be an occupational therapist. Do you know of any stories? Or
well, I guess one of my favorite is somebody who just actually came back recently and visited, and she was an interior designer, not a decorator, but a designer. Before she came to OT school. She came to OT school. She never had graduated from college. She came to OT school when she was 50 years old.
Wow.
And now she has a thriving private practice that helps people with disabilities redesign their homes so that they can...
That's amazing how it just links together.
And I think that's an unusual combination.
That is, but you have to think about those things, because with occupational therapy and how people move around in their house, that's huge. Now, with your graduate education program, once the student completes it, what areas in the field do they typically go for? What do they pursue?
I don't think there's anything typical.
Really?
Many of them go to traditional sites, like the medical rehabilitation site. So we have people that work in hospitals all over the country, all over the world.
Right.
We have people who go into school systems. School systems are one of the largest employers of occupational therapists.
Yeah.
And we also have people who go into the community. That's one of the kind of hallmarks of our program is community practice. So we might have a graduate go to a community site for people who have mental health issues, as well as were ex-offenders.
Wow.
And so they might go to that program and they might help people develop work readiness skills and habits of everyday living, and social skills, so that they'll be able to go out and hold a job.
Wow.
So a lot of different...
It's not typical. It's a wide range of fields they can go in. Wow.
Yeah.
Now, you being the dean of the School of Health Professions, and what are some of your own special research interests within occupational therapy?
Well, I'm what they call a qualitative researcher by training, which means that I don't do experiments. I go sort of...
more so work, writing, typing.
Well, yeah, but I go into places where we don't know much about the phenomena.
Okay.
And we collect stories about it. So, and that's helps jumpstart research.
Wow.
So I'm interested in what they call the lived experience.
Okay.
So I've done a lot of qualitative research across a wide variety of areas, but most recently I've looked at the experience of older adults living at home in a urban community.
Right.
And I've looked at the experience of being a caregiver of people with dementia.
Yeah.
And just this morning, one of my colleagues was in the office about a project we did looking at the goals that parents have for children who have autism.
Wow.
And trying to categorize those goals so we know what they choose the most.
Yeah.
You know, do they mostly care about socialization for their child? Do they mostly care about mealtime with the family?
Right.
Do they mostly care about being able to play outside? And if we could collect that, when we collect that information and analyze it, it helps us develop programs that are very much what families want. Okay.
Do you, now, here at Jefferson, do you, like, what other organizations do you work with in efforts for your research? Like you already said dementia, but have you worked with, like, I don't know, the Alzheimer's Association, like different associations? Have you? Okay. Oh, wow.
Yeah, we have a lot of relationships with organizations that allow us to do pilot studies, but also that we partner with to provide opportunities for our students to practice in those, do clinical practice in those centers so they can develop skills.
Right.
And we also have some contracts with, for example, we have a contract with Pew to deliver services for people who have dementia and their caregivers, or a school system that may want to provide special treatment for children who have autism.
Wow. And do you work with a lot of the schools more so in the city? Because I know you guys want to stay with the urban base, but or also outside the city.
Well, I would say we are primarily in the city.
Wow, yeah.
We have some programs that are definitely outside.
Of course.
But I would say the majority are in the city because we have clinical opportunities. Our students go out, when they start the program, they go out 1 time a week.
Oh, that's good.
But when they're getting ready to finish, they go out for 2 full-time 12-week sessions.
Wow.
So we try not to cause too much of a burden for them in terms of travel. Sometimes we have to.
Yeah.
but
it's good that they're getting the field work. Now for our viewers, for those who may be interested in getting an occupational therapist, what will be some of your suggestions or your guidelines in picking the right one?
Yeah, that's a hard question. I mean, I think you have to sometimes go with your gut.
Right.
And you have to say, you know, this is somebody I could really work with.
Okay.
I like him, I like her. I think that they are hearing what my concerns are.
Right.
I don't feel like they're judging me.
Right.
So you feel a certain kinship, just like you do when you pick a doctor.
Right.
I think the other thing is you want to look for somebody who has experience in this area.
Right.
And you want them to be able to tell you what kinds of experiences they've had and how they think you might improve, what they think I'd say the course of your improvement is going to be.
Right.
And I think just like you said to me, can you give me an example?
Yeah.
I think you want to ask them, can you give me an example of someone else you worked with like me?
Yeah, and you've helped them. And
how they've changed,
right.
yeah.
That's awesome.
Yeah.
Well, thank you so much, Janice, for having us. This was awesome.
Yeah.
So thank you.
Thanks.
That's all that we have here on Health and Wellness. Again, I'm your host, Karima Williams.